Over the years that I've worked, digital technology has changed everything several times.
I've had to learn a new language. When we started down the digital track, I realised very quickly I needed to learn to understand what was being said in the room.
For me in my career, the internet, that was an amazing piece of technology, and it enabled so much patient experience, but also search and research at your fingertips.
Yeah, it's changed quite a lot, particularly in the last 5 years. COVID was obviously quite a catalyst for a lot of technology changes. I'd say things that seem small were quite large, like e-prescribing was a big change to my clinical practice, as well as the AI scribes that seem to have taken over primary care and now EDs.
Over the years, the innovations that stand out to me are more about people embracing change than they are about the bits and pieces of technology. Technology comes and goes, but the main constant is people and how people react and interact with technology.
A key milestone for Awanui has been digitising our anatomical pathology. And that seems really basic, but it has completely changed the game for Awanui and for diagnosing cancer in general.
I think good digital care for patients in New Zealand looks like a relationship that is between patients, whānau and their healthcare providers.
Good digital care for patients in New Zealand actually means putting the patient in the centre, and I know everyone says that and we always talk about it at the top table, but do we actually do it?
Good digital care for the patient is something they're not aware of. Something that is just going on in the background where they're still getting that human connection. It's about the experience. They want to know how they feel, how you make them feel. At the end of the day, digital has to become invisible.